love, health beyond measure is our life, and our dust most finds us. We ask ourselves, who am I to be? When ghost can't family. Actually, we were not to be. Your child down, being smart does not show the world around you. For honor to shine, as children do. We're born to make manifest and grow God in us. It's not just in some of us, it's in everyone. Every own shine, we're going to do our permission to do the same. As we do it from our own first, our presence automatically awaits others.
Well, that may have been some of the best testimony. Thank you for that. And sir, would you please have that and how President threatens policies are implemented, part of your written report, and submit that within the 2-day period? Thank you.
Hello, everyone. My name is Farrah Burleson, and I'm a career coach and navigator with the Google Industry of Kentucky's Another Way program for homeless initiatives. In the winter of 2021, I was homeless, addicted, and justice-involved woman sleeping under abandoned houses at night and hiding in garages by day. I was surviving on scraps of comfort, driven into death and despair. I had no plan, I had no hope, and I had no will to live. Then I met an outreach worker who told me about a job opportunity at the Google Industries of Kentucky. If I could just get there, the seed of hope was planted deep inside of me. Before I could make this appointment with my destiny, the law found me, and I was arrested while hiding in a garage on a warrant for missing port on a trafficking controlled substances charge. I was exhausted, and I welcomed that arrest. I needed to sleep. That moment, though dark, became the start of my turnaround. Addiction had taken nearly everything from me: my freedom, my family, my sister, my teeth, my beauty, the chance to mother my children, the lives of my mother and my grandmother, my money, my time, and most painfully, my ability to rest. The morning after my arrest, I appeared before the judge, who looked at me and asked, "What's going on with you, Miss Burleson?" And I said, for the first time in my life, I stopped running from myself. And I said the harshest words I've ever spoken: "I need help." And he gave me a chance. Thanks to Medicaid, I was able to access addiction recovery treatment. There was no way I could have afforded it without that support. It was vital. Medicaid literally saved my life. Recovery gave me clarity, dignity, and the chance to rebuild myself. Once sober, I went to Goodwill for a job. There, I used every resource available, including skill ups and jobs, trainings. I did job coaching, housing help, transitional support, and with time, effort, and community support, I graduated out of needing SNAP, Medicaid, and transitional housing. I used Medicaid for all of my health care coverage needs throughout my recovery until I was able to acquire employer-sponsored health and retirement benefits. I now own my car, my home, I'm a college student, and most importantly, I own my life. Today, I work in human services, helping others walk the same path out of darkness. One of them's name is Maurice Malcolm. He was not able to be here today. He had to work. He is a client at Goodwill who reminded me so very much of myself. Maurice and I met in November of 2024, and he had the courage to want more for himself. I had the honor of walking along beside of him, encouraging him, connecting him to resources, and celebrating all of his little wins. Maurice used Medicaid because he's HIV positive and a diabetic. To get into treatment, he needed his Medicaid, and he embraced every opportunity that Goodwill offered him. He even went to prom recently and started chasing his dream of being the prom king. Literally, he sent me a picture, y'all. Through the Good Samaritan program, a program I now serve as his ambassador, Maurice continued to build his new life. This program walks with people, not by them. That partnership matters because real recovery isn't just about sobriety. It's about human dignity, housing, health care, and hope. Maurice recently celebrated 1 year sober with pride. He handed me his chip and said, "I did it." And I couldn't be prouder of his resilience, his heart, and his healing. He's now looking for his first apartment with the help of his Goodwill career coach, Rebecca, and he is a valued member of this community. His story is not unique. We see this kind of transformation at Goodwill every single day, but only when these support systems are in place. Let me be clear. Without Medicaid, SNAP, Good Samaritan, Goodwill, VOA, etc., of all the programs listed, Maurice and I would not be here. These are not just benefits. They are all lifelines. They are all second chances, and they are all essential. In closing, I urge you to please do not take away the tools that help people recover. Reducing access to Medicaid, SNAP, and vital programs doesn't just create more struggle, it robs our community of hope, stability, and redemption. Thank you for your time and for listening to the voices of those who fought so hard to be here today.
Thank you very much for that testimony. Again, because of time, we're gonna go over slightly, but we're gonna, and if you would relinquish your seats for, the next panel, which will include Dr. Swanee Jett, Dr. Wayne Tuxton, and Kathy Eco. We're gonna begin with Dr. Jett, his hard stop, to get his testimony, and we'll proceed. We're gonna try to stay as closely to that time frame as we can. And let me say this is unfortunately going to adversely affect our audience part of this particular presentation. However, those people who are here, we would hope that you would follow us because we can continue this discussion in Kentucky and we'll go forward and we'll stay connected with the national initiative and the fruits of our interaction will be engaged and felt. If you will begin, Dr. Jett.
Thank you, distinct panel, for inviting me today. So I have a lot to say, but very little time. So I'm going to this testimony. I'm Dr. Swanee Jett. I come to you from 2 different unique positions. I'm currently the CEO of Park Quality Community Health Center, but I'm also a former health commissioner, being health commissioner in Willard County, so I can talk to you about the role being health commissioner in similar county, Sanford, Florida. And also in Brookline, Massachusetts, as well as the health commissioner and epidemiologist that work on COVID. But also I was the past president of the National Association of County and City Health Officials, which covers 2,800 health departments nationwide. So I lend you a very different perspective. Today, Park Ball has grown. But the issue is, we have grown because the need is greater. We do adult health, pediatrics, women's health, OBGYN, behavioral, dental, wig, lab, and pharmacy. It was born out of 1968 during the Civil Rights Movement because African Americans didn't have health care. They didn't have access to health care. They didn't have ambulance. So Park Ball was the first to establish an ambulance service in the city of Louisville. Then we helped Family Health Center come established. So cuts to Medicaid will impact a number of people in the state, number of employees, and the population overall. In 2023, Medicaid covered 94.6 million people. Today it covers 78.5 million people. 41 million of those people are children. I can't really see a whole bunch of children under 18 years of age who won't work, right? 40% are white that receive Medicaid. 20% are African American. But African Americans have the worst chronic diseases in the U.S. per capita. Hence, the city of Louisville has not changed since I first got to public health in 1995. So it's just exacerbated. So communities were made vulnerable, really, through capitalism. Right? Dr. W.E.B. Boyd said we was gonna have the greatest need in America due to capitalism. And you wanna make more cuts. Public health infrastructure was already bad. That's the reason we could not respond to COVID. We had to ask for emergency money from federal government. They had to pass a bill with the claim of public health emergency. I had to claim a public health emergency in Brookline, Massachusetts, right? I had to put in a mask mandate when the federal government would not. I saved more people per population in this country than anywhere else because of the mask mandate. Those basic preventive services is something else. Now, let's look at the housing situation. How can we cut housing and then we have a homeless problem in every city right now? Right? We have cuts in rural communities where hospitals are hard to close. I have a site in imminent.
It's not.
There is no other health service there. We are it. And we can barely provide transportation to them. I have a population of 37% that come in uninsured right now today, right? 60% have Medicaid. Make a deeper cut, there'll be more people out there homeless, right? When you look at the top 10% of households has 67% of the wealth. Only 50% have 2.5. Study consistently shows that higher incomes leads to better health, right? Go into any impoverished neighborhood, the food is very cheap, right? And it's very poor quality, right? Going to the wealthy neighborhoods, the food is very expensive, but it's good food. So, cuts to education impacts the course of the food. You talk about the communities already, right? The teachers don't get paid a lot, right? And every time we have an emergency in this country, we need funding, right? We have cuts to Planned Parenthood. People talk, well, let's cut Planned Parenthood, let's get rid of condoms. All of a sudden, you have a rise in teenage pregnancy. I've already had 2 grants canceled by the federal government. One is dealing with air pollution in the West End with overtime. The other one is making parks that are not being maintained by the city, able so people can go and exercise, right? In the last month alone, 1 million people enrolled for Medicaid. The Medicaid had a huge expansion during COVID. All that has been lost, right? Medicaid is free or low cost to millions of Americans, including children, pregnant women, and people with disabilities. So if a woman comes in Parker Mall or any hospital and they're their third trimester and they don't have health insurance, Medicaid, we have what we call emergency Medicaid. So if you come in, you cover right there. So Medicaid covers not just those services, but doctors, hospital stays, prescription drugs, preventive care, dental care, mental health services, chronic diseases. So chronic diseases is highest in African. But not only that, it pays for hospitals, right? And any emergency services. So President Lyndon Johnson saw a need and an important step providing health insurance for families who couldn't afford private health. The United States still has the highest rates of money that we spend on health insurance, and yet it's ranked in the 30s in terms of health outcomes. That impacts, if you're not healthy, you can't work, right? So let's be clear, all these cuts of board are what we call impacting social determinants of health. That's what it is. So I'm at the end of the spectrum, but my job for 30 years has been to move upstream. I think this country deserves better. I think the need is still great, and we need your help. Thank you.
Thank you, Dr. Jack. You're up. Please introduce yourself.
Okay, now, Raj. I'm Jackie Hinko, and I am just speaking for myself today, but I am the former director of the Metropolitan Housing Coalition, a former director of the Housing Authority of Jefferson County, how old I am, and a former legal aid attorney in housing, so I am old. And I'm going to put in testimony that has maps and charts that back up everything I say, and you will be poring over them. First thing I'm going to tell you, and it comes as a shock, Louisville is segregated. I bet you didn't know that. But what I want to stress is how intentional that is, and how it continues and calcifies and is codified in our zoning. Now, people call the land development code, and they say it's about land use. When it comes to residential, it is not about land use. It's about who is going to be living there. That's exactly what it's about. If it's residential, then it has to meet building codes, be safe, and it's for people. Everything else is slicing away at who can live there. how big the land lot has to be, what you can put there. All of that is to exclude. Now, I was asked to look at this from the perspective of the Black community, and one of the things I can go back to Buchanan v. Worley, because I know you're a lawyer, in 1917, when the council in Louisville, block by block, said where Black people could live. It was thrown out, but that's how committed we are that our current zoning is built upon that premise. And the homeowner loan corporations, you know about redlining, you can go to louisvilleky.gov and see the redlining project and be stunned at how the lending community outlined geography and did red lines, and how much that is still the same in effect today. So Louisville is intending to do zoning, and guess what? The Kentucky legislature stepped in. And they said, no, we enjoy continued calcified codification of segregation, and we're not going to let you do that. The legislature stepped in when Louisville allowed renters more rights to rent a unit by saying, hey, if you have a legitimate source of income, that needs to be counted. The state legislature eviscerated that. Why is that important? Well, guess what? While 72% of white households own, 36% of Black households own in Louisville. Rental issues are Black household issues. So where multifamily is, and you'll get a map of where that's allowed, 6% of the land is for multifamily, the rest is for single family, most of it is for large lots, and it has had the intentional effect. And I'm cutting out a lot, but let's just talk about for a second, what's the outcome of rental? They have 24% turnover, which means in Jefferson County Public Schools, 80% of the kids experiencing homelessness are either Black, Hispanic, or mixed race. That's what's happening to our children, that's because of this turnover, and I wanted to make sure you knew that. Why do we have a Black low home ownership, and why is rent a Black household issue? When you look at the home mortgage data, it'll be in there, you'll see the disparity in getting loans. But I also believe that our policing system removes men just when a couple, we need 2 incomes, would be purchasing a home. I think if you did the old population pyramid actually shows an indentation of Black men between the ages of 25 and 45. You remove them, how can families buy a home? The other thing I want to, because I'm really cutting this short, there's maps out all over the
That
place.
submission, believe me, will be part of the record. So
Yes,
really
you better believe it.
Please hit your meeting.
But I want to leave you with this, because I want you to not be able to sleep at night. As of January 23, 2025, Louisville Metro Housing Authority was serving over 14,000 households and spent over $180 million. And they had 2,152 landlords. When the HUD proposal to cut HUD by over 40% is aimed at Section 8 and public housing, and you'll see the map of where they are located, and thousands of households lose that assistance. Our community loses those millions of dollars, and the concentrations in certain neighborhoods, that is going to be one heck of a frightening experience. Now, what you can do, how about $500 million towards housing in the next budget? I realize we say it wasn't a budget year, but we curtailed how much income we're having to put in. I don't know how that could happen and not be considered a budget issue. But when the budget comes up, $500 million for Kentucky to build housing, not just because I say so, but the Chamber of Commerce for Kentucky needs it, the Kentucky Housing Corporation says so. So you get all the maps and charts you need to back you up.
Thank you so much for that testimony. We look forward to seeing your submission. Dr. Tyson.
All right, I'm Wayne Tuckson. I guess I'm at the end. He was a colon and rectal surgeon. I'm very comfortable being at the end. So that's what I would like to do, and I'll try to be very quick with this. I'm going to address a question that was raised about what is the unifying concept that we can look at, trying to bring rural and urban divide together. And it was pointed out that healthcare, and some people put their hand apart, seeming to imply that the difference between healthcare in rural and urban areas, there was a divide there. Actually, they're right against one another. And the unifying concept, the joiner, if you will, is Medicaid. Now, you heard a few numbers from Dr. Jett and numbers that I know Dr. Irwin knows, but 28% of the people in Kentucky are on Medicaid. Now, let me just go through. In the first district, the congressional district, James Coleman, 32% Medicaid. Brett Guthrie, the chair of the Committee on Energy and Commerce, which is where Medicaid, I'm sorry, I said Medicaid, I meant to say Medicaid, where Medicaid is being decided, 31% people on Medicaid. Morgan McGarvey here in the third district, 30%. Thomas Massey, surprisingly low at 24%. Fifth district, Hal Rogers, 44% of people in Hal Rogers district are on Medicaid. And in sixth district, Andy Barr, 26.2% of people. I just think about that. This is a concept that covers everybody. So when you're talking about healthcare, in particular who has access to Medicaid, now what's the big deal about Medicaid? Well, we know that people have Medicaid, and when we saw it under the first Bashir regime, we saw, I don't mean that in a bad way, we found that with the implementation of the extended Medicare, we saw that there was a decrease in severity of chronic illnesses. We had fewer people dying from hypertension, diabetes, and cancer. People were getting better. What did that mean? Therefore, we had people who were able to participate in the workforce. They were contributing to the economic growth and development of their community. More viability within each one of those families. You also found that you had decreased uncompensated care. And again, you want some numbers, talk to Dr. Irwin, he'll tell you, and you can talk to anybody in the rural hospitals. They were getting more patients coming in for providing funding. With that money that was coming in, it increased the amount of people that they could hire and also became a jobs bill. So that you had employment, not just within the healthcare sector, but also in restaurants, bar shops, and surrounding areas, because people had money they could go out and spend. So when we talk about what does Medicaid do, so not only does it provide access to healthcare services, but it provides income to the various communities that they're in. So when we think about that, we are number 6 in Medicaid in the country. And by the way, of our 6 congressional districts, they're all in the top 200 of those receiving Medicaid in the country. In fact, 5 of them are in the top 100. So you want to talk about bringing somebody together. You talk about the impact, we're talking about health care, because of taking away somebody's Medicaid and how they're not going to get services. You now tell them, oh, I'm not going to get screened for colon cancer. Oh, I'm not going to get my treatment for my lung disease. You'll bring everybody's attention. A final point to this is when we look at pre-authorization. This is a bugaboo that affects not only me as a physician, but affects the patient. So let's talk about, we've heard a lot of talk about substance abuse and mental illness. So what do we know about pre-authorization? When patients can't get their medications, and what is pre-authorization? It means I've got to now justify to you, the healthcare provider, the HMO, in this case, managed Medicaid rather. I apologize for keep saying Medicare when I need to say Medicaid. But when we say, when you say to that person, I have to justify and explain to you why I want this particular medication. Now let's take a person with schizophrenia. Schizophrenia is very difficult to manage. And if I have to go a period of time without providing a medication for that schizophrenic patient, then what happens to them? They're out on the street. And if they're on the street, what happens? They get into trouble with the law. Where do they wind up? The very worst possible place a patient with mental illness can wind up, and that's in jail. So we now increase the cost of caring for that individual, and we're taking up space in the jail. And the last thing, when we're talking about drug abuse problems, how we're gonna maintain people, again, we need to have the ability to treat people. All this is combined in that Medicaid. So I'm addressing you about House Bill 695, which was passed. You wanna talk about something? I'm not even gonna get into House Bill 4 when we talk about DEI and how we're gonna train people. But if you wanna unify people, we talk about the unifying concept, you would ask, and Representative Brown, let us concentrate on how we're all gonna be screwed on this healthcare thing. Not just in bad health, but economic. Thank you.
Thank you so very much. In the interest of time, first of all, I want to thank everyone that's come to participate. So, in the interest of time, I want to thank everyone who's participated here. I want to thank the audience for coming and taking part. This is not the end of it. It will continue. We will be reaching out, so please stay tuned. And then lastly, I want to thank this panel, particularly those who came from afar to sit here. And we will be coming together and discussing this going forward. Thank you for the very valuable testimony that you provided. Lastly, well, next to lastly, we want to thank our organizer. Yes, I'm sorry. I'm sorry, say it again. Your final words. We can do that. Yes. Those who want to make a final word, you want to start with Representative Brown here.
I'll start. Thank you all so very much for coming out. I'm from Lexington, and issues in Jefferson County are very different than they are in Fayette County. But the problems we have are acute. And in trying to address them and trying to address the budget cuts that are being proposed by the folk in DC that are going to trickle down and affect everybody in this country. And some of them are more acute than others. It is important that everybody that spoke, and I felt the passion, I heard what you had to say. And I think it's real important to understand, but understand that we as legislators, we're 138 members in the House and Senate of the Commonwealth of Kentucky, and we do not have a baseball bat to fix it. But what you can depend on is that we will work to try to fix it and to try to make it happen in the General Assembly. A lot of the workforce issues that you all raised up, some of the healthcare issues that you all raised, we're filing those bills. We just can't get them heard. We can't get them in a position that they become law in the Commonwealth of Kentucky. So understand we're in the fight with you, and it's a tough thing to deal with the blame game, because there's one finger pointing at you, there's four pointing back at me, or three pointing back at me. So let's work together.
We're going to say pretty much the same thing.
Through every note, every performance, the arts connect us. The arts connect us through joy and through awe, bridging cultures and generations. From intimate theaters to the grandest stages, the arts bring us together, reminding us that we're never truly alone. When we experience the arts, we experience each other. Kentucky Performing Arts. The arts connect us.
If you do nothing else.
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 If you do nothing